Nurses at Snohomish County's largest hospital say staffing levels are at a breaking point and say levels are on a steady decline, and it's creating a dangerous situation for patients.
The union representing nurses at Providence Regional Medical Center Everett say 600 have left or retired since 2021. King 5's Drew Andre is live in Everett. Drew, what needs to happen to increase these staffing levels?
Well, good morning. The hospital's chief nursing officer said they'd have to hire about 400 nurses to get to what they would consider strong staffing levels, a place she says they were before the pandemic. And right now there are contract negotiations going on that will dictate the future.
A career in healthcare means hard work. But nurses at Providence Everett say too often they see a stream of patients with not enough staff and no end in sight.
Not having a chance to use the bathroom or put food in your mouth for 12 hours straight and then staying 2 to 4 hours after your shift because there's nobody else to take over and you don't want to leave somebody in need without somebody. And not being able to.
Labor and delivery nurse Dana Robinson says one day recently in the postpartum unit, there was just 3 nurses for 22 couplets. She says that's more than double what it should be. While on the hospital floor, the expectation is 1 nurse to 4 patients. Lately, nurses say it's closer to 7 or 8.
That's impossible, and that's like horribly unsafe.
Providence Everett covers a large portion of Snohomish County, which has always made it a busy hospital. But now workers say with their current pay, there's not much incentive for many to stay.
A lot of nurses will leave here and go to our sister hospital where they can make a little bit more and have less patient loads.
Our wages right now are not competitive. We're not market competitive. And so we've got some work to do there. We recognize that.
The union and hospital are in current negotiations on a new contract. Chief Nursing Officer Michelle Lundstrom says they've offered a 13% increase in pay, and meantime are also attempting to get creative. For example, having nursing assistants check vital signs and do other tasks she says registered nurses would traditionally do alone.
If we know we're short for RNs now and we're going to be short RNs 10 years from now, we're going to have to lean into some of these other creative staffing models where everyone on the care team is working at the top of their license.
The union says the wages need to be above other area hospitals' current contracts so they remain competitive for several years.
You want to be attractive enough that people want to stay and they want to be here.
And if that doesn't happen, many nurses have agreed to strike if a deal isn't reached.
When you have nurses that are saying that, you know things are really dire, really dire.
And Robinson says she is among them. Next week, there are 2 more meetings where there will be negotiations. Both sides say they feel like they've been making progress lately, so it is possible that a deal will be reached here in the next few weeks.
So, Drew, is it possible that these nurses could go on strike if there is no deal?
Right, it's definitely possible. The current contract is up at the end of the month, so there needs to be that deal made by then. The hospital told me if there is a strike, they are prepared for that situation. They say they would hire qualified nurses to fill those spots, but of course, it's not clear how many people they could bring on in that situation.
A crisis level indeed. All right, Drew Andre, thanks. We'll keep checking on this story.